Hello everyone, my name is Ahmed Mattar, one of the Orthopaedic Junior doctors in Princess Royal University Hospital, King's College Trust. Today I'm going through the quality improvement project of training assessment form. Training assessment form, it's a form which will be done for the assessment of the SHOs in the training shift. Training shift in our trust stands for the clinic shift for the SHO or the theater shift. When the SHO we have as junior doctors shifts in theater and in the clinic. We go quickly through the background and the methodology, aim and objectives and the result of this project. The background and the current problem for what we did this project and this form, because there were a lot of complaints from the consultants and seniors in terms of the registrars as well. They were not happy or satisfied completely with the performance of the SHO, especially in the clinic and sometimes theater. At the same time, junior doctors and SHOs were not happy with their the jobs needed to be finished and done by them either in the clinic or theater. That's why we try to find okay, where is the problem? How can we improve these issues? That's why we made two surveys. The first survey was for the consultants and registrars to check and give us the feedback about the training shift for the SHO, what's their expectations, and how to support the junior doctors more and more, especially in theater. The second survey was done for the SHOs to collect the feedback about their performance, their weak points, how satisfied they are with the training, how satisfied they are with their involvement in theater, and it's including all of the orthopedic team in our hospital. The aim for this project is to know the good and weak points for the SHO, and from the registrars and senior level, how to support the SHO more and more. We did this, we made this two surveys and circulated between all of the consultant and registrar, and the second survey was circulated between all of the SHOs and junior doctors in the department. As a result, the first survey was showing only 15% of the seniors, registrars and consultants, they were satisfied with the SHO performance in theater, especially in assisting. However, they were not satisfied. Only 10% were satisfied with the performance in the clinic, and they thought that, and they see that it's more important to be involved in clinic more and more. And the second survey for the SHO showing that 45% of the SHO are satisfied with their training shift, and only 40 are dissatisfied from the clinic. A majority of the SHO need to have more support and more involvement in theater. That's why we discussed between the consultants and registrars, and in one side and the other side with the SHO, and at the end the discussion gave us some important points. One of them is to have more involvement of the SHOs in theater and clinic. Also, the junior doctors need to have to show more and make more efforts in the training shift, especially in the clinic. That's why we made this form. This form will be considered as an evidence of the jobs done per training shift, either in the clinic or the theater. The first form is this form. The first cycle is done for the theater, showing the jobs need to be done by the SHO before the surgery, either by preparing the patient for surgery, either by checking the bloods, joining the briefing before the surgery, and collecting all of the details of the patient, reading history, joining the trauma room in the morning, checking and ordering for the x-rays for theater, and so on.